Welcome to Learn with Livanta, Medicare, the BFCC-QIO, and you, Livanta's podcast where we bring you up-to-date information about the QIO services and the overall Medicare landscape. In this month's episode, we're going to focus on the appeal process, one of the services Livanta provides at no cost to all Medicare beneficiaries. To set the tone, we're going to begin by hearing a case study of an appeals case, and then move into an informative conversation with Brian Fisher, another member of the Livanta Communications team, to learn more about the appeals process. The true-to-life story you're about to hear is based on stories of Medicare patients, families, and caregivers. The services that we provide at Livanta, including the appeal process, help to resolve barriers to care, inspiring hope and confidence that those in need can successfully navigate their care. Any resemblance to persons living or deceased is coincidental unless otherwise stated. We hope you enjoy.
I've been taking care of my dad for a few years. He still lives on his own, but I help him out when he needs it. Recently, my dad told me he didn't feel well. He said it felt like an elephant was sitting on his chest. He was having trouble breathing. I took him to the emergency room immediately. I was so scared. Was he having a heart attack? Was it something else? I had no idea. The ER doctor ran several tests on my dad. He had had a heart attack. Thankfully, my dad survived the heart attack, but as I looked at him lying in the hospital bed, he looked so pale. I had never seen him look so frail in all my life. He was stabilized for the moment and waiting for open heart surgery. Surgery went well, but Dad was really weak and had several weeks of recovery ahead of him. Unfortunately, there was permanent damage to his heart, and some aspects of his life likely would never be the same. Dad spent a couple of days in the ICU and then a few days in a regular hospital room. He wasn't able to get out of bed on his own because he was so weak. I didn't know what would happen next. How long would he be in the hospital? Would he go to a nursing home or a rehab of some kind? Then a case manager came to talk to us. She said Dad was being discharged and she was there to go over some paperwork with us. I asked where he was going and she looked at me and said, "Home." I was shocked. I looked at my dad and back at the discharge planner and said, "What? He can't take care of himself. He can't even get out of bed on his own." She said, "Well, home health will come in a few times a week." She rattled off some more information that at this point just sounded like noise and thrust some papers at me. She walked out and I sat down next to Dad's bed. Shocked and with tears in my eyes, I began looking through the papers. Near the bottom of one of the pages was the word appeal and a phone number. I didn't read anything else. I just grabbed my phone and called the number for Livanta. A man answered the call and asked some questions. I explained what was going on with my dad and that there was no way he could go home. The man from Livanta helped me to get an appeal started for my dad. While the appeal was being reviewed, Dad was able to stay in the hospital. We won the appeal. Dad only stayed in the hospital a couple more days, but instead of being sent straight home, he was sent to a nursing home for rehab to help him get stronger and be able to take care of himself again. Dad didn't need to stay in the hospital for much longer, but he wasn't ready to go directly home. He still needed help, more help than I could give him. The few extra days gave him time to recover a little more and for his care team to reconsider sending him straight home.
Today we'll be speaking with Brian Fisher, a longtime member of the Livanta Communications team. So Brian, tell me a little bit more about your role here at Livanta and then your experience working with appeals, much like the case study that we just heard.
Well, my name is Brian Fisher, and I am the Community Outreach and Education Coordinator here at Livanta. I've been here for about 10 years, and as a part of the work that I do, one of my jobs is to meet with people and to educate them, inform them, empower them with information about their Medicare rights. I've traveled all over the country, from one end of the country to another, from Puerto Rico to New York and to California and back again and everywhere in between to help people understand what their Medicare rights are. And in those travels, I've met a lot of people who have had experiences a lot like the story that we just heard. people who find themselves in a medical crisis. And as a Medicare beneficiary, they have certain rights and they're able to act on those rights to help ensure that they are getting the care that they need.
So, taking one step back here before we get too into the details of the appeals process, let's talk about just the simple fact that Livanta is a BFCC QIO. Could you explain a little bit more about what that is?
Well, sure. A BFCC-QIO, and that is a long acronym. A BFCC-QIO it stands for Beneficiary and Family Centered Care Quality Improvement Organization. And BFCC-QIOs, Beneficiary Family Centered Care Quality Improvement Organizations, are contractors that are hired by Medicare to make sure that Medicare patients get the care that they deserve. So I mentioned that Medicare patients have a right to receive quality health care. And the BFCC QIOs, like Livanta, are responsible for protecting that right to quality health care.
So, you've sort of talked a little bit about this already, but what's really our specific focus and purpose here at Livanta?
Well, as you know, as I said, our end goal is to protect a Medicare beneficiary's right to receive quality care. And we do that through three specific ways for Medicare beneficiaries. Probably the most common reason that a Medicare beneficiary contacts us is to appeal their decision to end services. So, what does that mean? So, if you happen to be, say, in the hospital and you get a notice from your care team at the hospital that says that they are going to be discharging you. They're going to be sending you out of hospital and into maybe another care setting, or they're sending you home. You have a right to know that that decision, that medical decision, holds up under professional standards. Did that decision meet professional standards? Is that a medically appropriate decision? Because if it isn't, that means you would be being discharged from hospital too early, premature discharge. And that can be a very serious situation if you're not ready to go home. And Livanta, as a BFCC QIO, our role is to hear those appeals from Medicare patients, their families, their caregivers, and review that decision to make sure that that medical decision was the correct medical decision.
So, Brian, could you again just making it real clear and understand? Could you just let us know like what is an appeal? You've kind of alluded to part of what an appeal is, but what's sort of the full breadth of what an appeal is?
Sure. Well, and it's actually, and I'm glad you asked that. It's actually a really fascinating process. And as I said, the fundamental sort of basis of the appeal is based on that Medicare beneficiary's right to receive quality care. But what the appeal actually is, sort of the nuts and bolts of it. An appeal is a formal way, right? It's an actual, like, it's a process. It creates a case. It's a formal way for Medicare patients to challenge a decision from their care team to discharge them from hospital or another Medicare covered care setting. And that process protects them from being sent home too early. Um, there are effectively two types of appeals. Probably what most people think about if they have of any kind of familiarity with Medicare appeals, is they think about a hospital appeal. We call those acute appeals, right? Because they come from an acute care setting, which would be a hospital. The other type of appeal, which is, it happens, frequently as well. Those are called post-acute appeals because they come from a post-acute care setting, which would be, like I mentioned, if you get sent home from hospital, you might now be getting home health services, or you might be sent from hospital to a skilled nursing facility for rehabilitation and other care, and you have the right to appeal those decisions as well.
So let's start at the beginning of this process. You know, how do you initiate this appeal, and alongside that, when can you make an appeal?
Sure. So I think what's actually really interesting about this process is that it is this effectively the same for Medicare beneficiaries, regardless of what type of Medicare they have. So if you have original Medicare, or say you have a Medicare Advantage plan, the process is very, very similar. It's effectively the same for both types of Medicare. But the way the process works is when, I mentioned it earlier, when you get that decision from your care team, whether you're in the hospital or in a skilled nursing facility or some other Medicare covered care setting, you're a member of your care team. Sometimes it'd be a discharge planner, it might be a social worker. The patient, will get a notice from their healthcare provider, from a member of their care team, and that notice will inform them of several things. One, it will inform them of their rights under Medicare law and regulation. So it'll go through their right to file the appeal. It'll go through their right to actually file a complaint about the care if they think they got bad care. But critically, it has contact information on that form. And that form has a section in there, and it's required to be filled out by the healthcare provider, by a member of the care team, to give you the contact information for the BFCC-QIO for your state. So that, for 27 states and territories across the United States, that is Livanta. And that form is going to have, it's going to say Livanta, and it's going to have our toll-free phone number on there that is going to allow a Medicare beneficiary, their family representative, a family member, or a caregiver to actually begin that appeal process. And so you can do that by calling that number. And very recently, Livanta actually added the ability to file your appeal online. And so you can file your appeal online, or you can call Livanta to file that appeal.
So after initiating the process, can you just talk very briefly about what filing an appeal actually looks like? Once you're at the stage, that you're able to make an appeal, what does that process look like?
The process of filing and having your appeal reviewed involves a licensed board certified physician. So once you call you call Livanta, you file your appeal online. What will happen at that point is a Livanta representative will contact your care setting, whether that's a hospital, a home health agency, a skilled nursing facility, hospice, or a comprehensive outpatient rehab facility. If you're in one of those big five care settings, Livanta will contact that care setting, let them know that you have filed an appeal of that discharge. And at that time, they will actually request a copy of your medical records. And so that facility is required, under the conditions of participating in Medicare, to submit your medical records to Livanta for a formal review. And so once Livanta gets the medical record from that healthcare facility, Livanta will then assign it to one of our board certified licensed physicians. These are doctors. And that doctor will review that medical record to make a determination, a professional determination, if they agree or disagree with the decision to terminate your care at a Medicare covered healthcare center.
So I've made the appeal. What happens next?
So once that appeal is received by Livanta and we get that medical record, and the physician reviewer, the doctor, has reviewed it, the doctor will say, okay, yes, I agree with your care team in their decision to end your services, or I disagree with your care team's decision to end services. And at that point, say if if the doctor disagrees, Livanta will notify that facility and say, we disagree. We think that the decision to terminate services is not medically appropriate. And at that point, the patient will actually remain in the care setting and covered by Medicare. That process itself typically takes between 24 to 48 hours on average. We do have, according to the Medicare statute, it can take a little bit longer, but for the most part, those appeals are reviewed and you will get your decision back from Livanta within 24 to 48 hours.
Well, Brian, I think we've now gone over pretty much the overall arc of the appeal process. Is there anything else that you'd like Medicare beneficiaries and their caregivers to know about the appeal process?
Yeah, I think it is really important to remember that it doesn't matter what kind of Medicare you have. Whether you have original Medicare or you have a Medicare Advantage plan, your right to appeal that termination from service is the same. So, there are going to be little sort of differences behind the scenes where, we'll have to notify the Medicare Advantage plan if you have one that you filed an appeal. But from your end as a Medicare patient, you have the rights are the same. The process is going to look and feel exactly the same. I think it's also really important to understand that the services that are provided by Livanta as a BFCC-QIO, these are provided at no cost. So, many times and Noah, thank you for asking. I've met with, probably hundreds of organizations and individuals over the nearly 10 years I've been working in the BFCC-QIO program for Livanta. And one of the things that people are very anxious about is they will ask me, they'll say, Brian, well, this is really great information, but how much does it cost? And I get to give them the good news that the services that are provided by the BFCC-QIO program are free. They are a benefit, an added benefit of having Medicare, whether that's Medicare Advantage or original Medicare. Your rights are the same. And I think that's a really special thing to be able to say to someone and let them know that this is a benefit. This is something that comes along with having Medicare. I think it's also really important for folks to understand that there are differences between the two types of appeals that I mentioned earlier. So I mentioned that you have appeals that come from a hospital. We call those acute appeals. And you have appeals that come from non-hospitals, other types of care settings. We call those post-acute because typically you would be in one of those care settings, like a skilled nursing facility, after you have left the hospital, right? So post-acute meaning after your hospital stay. And there is a difference between the way that those appeals work. Medicare classifies those differently. That's why we have to talk about that. There are some specific timing differences. So we talked about how an appeal takes between 24 to 48 hours to get a decision from Livanta. And part of that is because for a post-acute appeal, you are required to receive notice of your termination from service, right? At least 2 days prior to that actually happening. And that gives Livanta those 2 days, if you file the appeal right away, that gives Livanta 2 full days to review that appeal. And what makes that so important is that there is a distinction between a post-acute and an acute appeal. With that post-acute appeal we're talking about, if you say wait until the last minute to file your appeal, and it takes Livanta 2 days to review that, and we come back and say, Brian, just want to let you know that our doctor reviewed your case, and our doctor agrees that you are ready to move to the next level of care. This is, actually, it's good news. In many cases, it means you're progressing. You don't need care at that care setting anymore. But if I wait till the last minute, and I lose my appeal, then there is the potential for me to have financial liability. I might have to pay for those 2 days that I've gone past my termination date and time. That's different than a hospital appeal, an acute appeal, where if you file that appeal and it takes 2 days and you're 2 days past your discharge date, Medicare generally will cover those 2 days. and you will not have, regardless of how that appeal goes, and you will not have financial liability. You will probably not have financial liability. So it's extremely important to understand that there are two different types of appeals, and that in general, filing your appeal early um, gives you the best chance to avoid any potential financial liability.
Well, and thank you for all of those specific cases, Brian. I think really at the end of the day, I think it's really important for people to know that we're here to serve Medicare beneficiaries and that we're here to help when you're in those situations where in those acute care facilities or other sorts of care. Could you briefly, before we go, talk a little bit, very, very briefly, about the other types of services that we provide? Because we can also support Medicare beneficiaries at other points during their care process.
Sure, and I think I mentioned it earlier when we were talking about the notices that you get when you are in Medicare covered care settings. You get these things; they're called beneficiary notices, and that beneficiary notice, in addition to giving you information on how to file an appeal that we've talked about, it also gives you information about what your other rights are under Medicare law and regulation. And as we've talked about, your right to get quality care means that you have the right to know that the care that you got met professional standards. Was that quality health care? And as a part of that, Livanta actually will conduct formal reviews of your care for up to 3 years after the date of service. So, what does that mean? It means, let's say, I went to the doctor's office last week and I think I may have gotten bad care. I have up to 3 years from that day to file a formal complaint about my care. And Livanta will take that formal complaint and they will conduct a full review of my medical records to ensure that the care that I got did, in fact, meet professional standards. And if it didn't, Livanta is part of a process that helps to educate healthcare providers and correct issues that are found during those reviews. Another tremendous advantage of having Medicare is that as a part of the BFCC-QIO program, you also have the right to ask the BFCC-QIO, to provide a service called immediate advocacy. And that service is effectively a mediation service. If you are unhappy or unsatisfied with the care that you got or are currently getting, you have the right to ask Livanta to mediate that, to try and intervene on your behalf and come to some sort of resolution. Try and figure out where we are going to meet in the middle between you and your healthcare provider, and work out whatever problems you may be experiencing. And just like with an appeal, these services are provided free of charge. They are at no cost, and it does not matter what kind of Medicare you have. This applies equally to both Medicare, original Medicare patients, and Medicare Advantage patients.
Well, thanks again, Brian, for taking time out of your day to speak to me and really speak to all the Medicare beneficiaries, their caregivers, and other people in the Medicare space about the appeals process here at Livanta through the BFCC QIO. Again, I'll leave you one final opportunity if you have anything else that you'd like to share.
Well, I think it's also, and thank you for that, Noah. And I think it's really important to understand that Livanta works really hard to make sure that this process is accessible for people. We don't want there to be any barriers to accessing these services because at the end of the day, it's your right to file that appeal. It's your right to file a complaint. And if you don't speak English, if you have limited English proficiency, or if you're working with someone, a friend, a neighbor, a family member that has limited English proficiency, you do not need to worry about that. We have an interpreter service that we have in our call center. And so if you speak any one of 200 languages, we can provide an interpreter to help make sure that your voice is heard in the process. We also are part of the 711 relay network that helps folks who are deaf and hard of hearing to communicate over the phone. So we try to make sure that we are very accessible, and specifically with filing an appeal. I think I mentioned it earlier, but I'll mention it again because it's extremely important. And that is anyone can file an appeal for anyone else. You don't have to be a formal caregiver, right? You don't have to be a family member or have, it's called power of attorney. You don't have to have any of these formal recognitions of your status. If you are a friend, a neighbor, a coworker, anyone who cares about another individual, you can actually begin that appeal for them. And it's extremely important that people don't feel that they can't do it. Because it's a very time sensitive thing, and it could be the difference between life and death and recovery and not recovery. And that's why Medicare sets that rule to make it very accessible. And we try to, to work towards that and making sure that there are no barriers to accessing these rights.
We hope you got more insight into the appeals process for Medicare beneficiaries by listening to our case study and our conversation with Brian today. If you want to learn even more about the services that Livanta provides, including the appeals process, you can visit our website, livantaqio.cms.gov, or follow us on socials at Livanta Cares on X, Instagram, YouTube, and Facebook. Thanks for listening to Learn with Livanta. Tune in next month, where we'll host a moderated discussion on health literacy and the impact it can have on Medicare beneficiaries. Talk to you then.